TNF-alpha inhibitor drugs. This one is high yield, guys. You have to know your TNF-alpha inhibitor drugs. So what are the example of TNF-alpha inhibitor drugs? Remember, TNF-alpha is one of the what? Right, it's one of those cytokines that we spoke about earlier that's been released from the macrophage. Remember, interferon gamma activate the macrophage, and the macrophage release what? TNF-alpha. And TNF-alpha helps with what? Very good granuloma formation. Is involved in granuloma formation. So what are these drugs? So these drugs include Infliximab, Adalimumab, Etanercept, Golimumab, and Certolizumab. And what do we use them for? So we use them for rheumatoid arthritis, ankylosing spondylitis, psoriasis, and then we can also use them for inflammatory bowel disease. And then most importantly, before you give this medication, because like we mentioned earlier, TNF-alpha is important in formation of granuloma. And remember, in tuberculosis is granulomatous inflammation. So before you give a patient this medication, you have to screen for what? Latent TB. Make sure they don't have TB, because if you give it to somebody who have latent TB or active TB, this could lead to disseminated infection or reactivation of TB. So adverse effects, so reactivation of tuberculosis, serious bacterial and fungal infection, also demyelinating disease. It could cause worsening of heart failure in those patients. It could also cause drug-induced lupus. So the patient could have drug-induced lupus. Remember, as you know, with drug-induced lupus, which antibody will be elevated? Very good. Anti-histone antibody will be elevated in drug-induced lupus. It could also increase the risk of malignancy, particularly lymphoma. A patient on biologic therapy for ankylosing spondylitis develop fever, night sweat, and weight loss, right? So fever, night sweat, and weight loss, those are what we call the B symptoms. So we call them B symptoms. B symptoms. And now we did a chest x-ray that show upper lobe cavitary lesion. So when you see B symptoms with upper lobe cavitary lesion, what are you thinking? Very good. You're thinking of TB reactivation. So you're thinking of tuberculosis, right? Which drug most likely cause this complication? So most likely this patient probably be on what? TNF-alpha inhibitor drugs. And because of the TNF-alpha inhibitor drugs, then that causes what? TB reactivation. So the best answer there will be C.